Dear chairs, dear audience, let me introduce my PhD topic, which is exploring the spectrum of oral disorders in different autoimmune diseases. My name is Ágnes Heizer. I work at the Department of Preclinical Dentistry as a second-year prosthodontist resident. My supervisor is Kristina Márton, and my scientific methodology supervisor is Jimin Lee. My vision is to give a better overview on the course of autoimmune diseases, and I would like to reduce the severity of symptoms in these conditions. Currently, we have two ongoing projects, both of them investigating oral disorders in autoimmune diseases, and started last year in autumn, and using the methodology of systematic review and meta-analysis. The first one is investigating the prevalence of oral disorders in Sjögren syndrome. If we look at these pictures, we can see a dry, probably very itchy eye, a dry mouth signed with fissure tongue, and also a caries. And if we put these pictures in front of dentists and considering these symptoms all together, probably the first diagnosis which comes to mind is Sjogren syndrome. Sjogren syndrome is one of the most frequent autoimmune diseases with a very variable prevalence rate depending on geographical areas. Every 39 individuals out of 100,000 persons are affected by this syndrome. We can differentiate two forms of the disease, primary and secondary form, where secondary means that Sjogren syndrome coexists with other autoimmune conditions. One of the most common and most unpleasant symptom is oral dryness, which not only increases the risk of caries, but also contributes to dental erosion. Saliva has a crucial role in protecting teeth. A continuous flow of saliva is very important to prevent candida colonization. Furthermore, these patients are much more prone to develop periodontal disease. So that is why we need tailored treatment protocols that addresses the unique challenges of oral dryness and the associated disorders. And our aim is to investigate the prevalence of oral disorders in this syndrome. Our clinical question is very simple. What is the prevalence of different oral disorders in patients with Sjögren syndrome? We chose the COCOPOP framework to work with, where the condition contains all the possible oral disorders which can happen in Sjögren syndrome, and we are investigating adult patients. We hypothesize that patients with Sjögren syndrome have a higher prevalence of different oral disorders. And if we provide treatment at an early stage of the disease, we can improve the quality of life. Here you can see my search key, where we use two domains. The first one refers to the syndrome, while the second one is to the oral disorders. We conducted our search in three databases, PubMed, Embase, and Cochrane. And here you can see the key articles, some of my key articles. Here, all of them investigated Sjögren patients and also healthy controls. Some of them differentiate the primary form and secondary form. And after we conducted our search, we got more than 13,000 hits. After the duplicate removal and the title abstract selection, we had 90 eligible full texts. On the right side, you can see the citation chasing method. After this step, we could say that our search key has found all the articles. Currently, the data extraction is ongoing. The second project is investigating the prevalence of oral disorders in systemic lupus erythematosus. This disease is also a chronic autoimmune disease with a variable prevalence rate depending on different factors such as races. Primarily impacting young women, SLE is characterized by an unpredictable course and a diverse range of clinical manifestations that affects multiple organs such as skin, joints, muscles, heart, blood vessels, renal system, and lungs. But one of the first indicators of the disorder is the oral signs. These oral signs include various forms of oral lesions, such as serostomia, all the symptoms which comes with serostomia, candidiasis, ulcers, gingivitis, and periodontitis. But we can say that these symptoms are often under-recognized in standard SLE care, so we need better collaboration between immunologist and the dental specialist. The clinical question is exactly the same as in the first project, just we are investigating oral disorders in systemic lupus erythematosus. Again, we use the COCOPOP framework, and if we recognize these early signs, it can aid in timely diagnosis and therapy. Here is my preliminary search key. And we conducted our search in 3 databases. I have found a previous systematic review and a meta-analysis, but it only focused on periodontitis, so our study could be a little bit wider. In this slide, you can see the key articles, where, as I mentioned, that SLE has an unpredictable course with active phases followed by remissions. So if we have enough data, it could be very interesting to see the differences in the different phases of the disease. And as a summary, I would like to submit the first project this year and the second one next year. And let me finish my presentation with a quote from Stephen Hawking: "One is always a long way from solving a problem until one actually has the answer." And thank you for your attention.
Thank you very much for this very nice presentation. I have one question for basically the first project. How is the population of Sjögren syndrome patients determined? What is is there a specific diagnostic tool with which these patients can be included in this investigation?
First of all, we are investigating primary Sjogren syndrome and in adult patients, so after the age of 18. But we can say that Sjögren syndrome is more common in older women. We can see from the data extraction, most of the articles investigated older women or middle-aged women.
Yes, but the question is, are the patients included according to an anamnestic questionnaire, or is there a diagnostic test which defines that they are Sjögren syndrome
Yes,
patients?
we have different diagnostic criteria. Currently, the most used the AOLR diagnostic criteria for Sjögren syndrome.
And are there any exclusion criteria of medication that can cause dry mouth syndrome as a side effect? Do you know?
Currently, we don't have an exclusion criteria regarding to different drugs, but we are going to think about it.
Thank you very much. We have a question.
Thank you for your presentation. I have a very practical question. I guess that you're working on this research. You have a sharper eye for dry mouth patients. And I'm asking for advice here. What if I assume that a patient might have Sjögren syndrome? Where should I send the patient? And what dental treatment should I implicate in first line?
Mm-hmm. We have a practice where we examine patients with serostomia and dry mouths. So you can send a patient to us. And what was the second question?
What dental treatment should be done in the first line?
So I think more frequent checkups needed because dry mouth can lead to more carious lesions. So I think a regular checkup and cleaning is very important in these patients. And if somebody has a serostomia, we can give them artificial saliva, for example, but we just suggest tips. For example, increase the water intake, and we can advise them to use different toothpaste, for example, which doesn't contain menthol, because it also can lead to dry mouth.
Okay, that's a good tip. Thank you so much.
Thank you very much. Do we have another question?
Hi. Thank you for this very interesting presentation. My question is similar to Katinka's question. What are the most common reasons for dry mouth as far as diseases or external factors that need to be separated from autoimmune diseases?
Thank you for your question. So, behind serostomia, there are many reasons. For example, it can present in middle-aged older women because of the hormonal changes. Also, different drugs, for example, antidepressants or antipsychotic drugs can lead to serostomia. Yes.
Is it true that less water intake can also lead to dry mouth?
Yes, exactly.
Thank you very much.
Thank you very much. We have time for another question.
Thank you for your presentation. My question would be that you've mentioned that SLE primarily affects young women, but which other age group can be also affected? For what do we need to pay more attention for?
Yes, thank you for your question. The peak onset is around the age between the age of 20 and 30, but we are talking about childhood onset SLE. If it develops under the age of 18, usually this type is more aggressive. And if it develops after the age of 50, we can talk about the late onset SLE. But these are less common.